A large and highly debated health reform in our country has been the Patient Protection and Affordable Care Act, which you may know as Obamacare. This was a law passed in 2010 to improve the access, cost, and quality of healthcare for U.S. inhabitants, such as citizens, immigrants, refugees, and undocumented. Although we have changed this reform since then, we still strive for the same goals in our country. In other countries, universal health care was introduced as early as 1883 by Otto von Bismarck from Germany, who then influenced other European countries. Now, although the reform sounds new to us in the United States, there was actually a reform debate going on since 1935 when Theodore Roosevelt tried to move in this direction, but was denied from doing so in the Social Security Act. It was thought that universal health care would have a negative impact on multiple industries and thus was never accepted by Congress. Another step occurred in 1965 when Medicare and Medicaid were introduced to help distinct groups of individuals like needy children or the elderly. Since then, we have tried to continue offering care, but with shortages of healthcare professionals, a stagnant quality of healthcare, and increasing uninsured rates in the country, we noticed the need for change. This need pushed the reform forward. In 2010, everyone was required to be insured or to pay a fine. Medicare and Medicaid eligibility was expanded to larger income groups and ranges of individuals, creating more access to health care. The reform also ensured better quality of care by funding states and provided monetary advantages and incentives depending on the success rates of companies. While 2010 brought this reform, arguments surrounding the legality of the penalty still lingered, which prompted further change, but what remained from this reform were the economically accessible healthcare options. So there's two sides to this ethical debate, which I'm going to present to you, and I would like you guys to think about how you view the situation. The first side of the debate views providing universal healthcare as a duty. This view sees healthcare as a social good, which means that if individuals are receiving this benefit, then the society as a whole, or as a unit, is also benefiting. The Rawlsian viewpoint is also in favor of helping those in need, which in this case are those who would not be able to afford healthcare otherwise. Lastly, the categorical imperative also supports this view because it states that we should act how we would want others to act towards us, which we would want some help. Now, on the other hand of this debate, healthcare is seen as a private matter, that individuals should be able to pick and choose what healthcare plan they would like to purchase, if any at all. The libertarian and market view believes that allowing states to decide their services and people to choose whether to purchase or not is allowing them to be free to make their own decisions, which is a right, and it would allow them to exercise their own autonomy. This controversy creates a fog over what the nation should do ethically. So, does deontology provide any support towards one view or another? What do you think? And with that, that's the end of this chapter. Again, if you have any questions, my email is in the syllabus, and I'll be happy to help. Thank you, guys.